I just started it early. Hopefully that's okay.
I
Oh,
also have the welcome sheet done. Should I pull that up?
yes, that would be awesome. Maybe I should stop recording until we start.
Does that look okay?
Oh,
Yeah.
we'll pause that for a minute until it's time. Okay. Oh, thank you. That looks great.
You're welcome.
That looks fantastic. Okay. We have 3 more minutes by my calendar, so we'll give it a few more minutes. Yeah, they thought they were going to have the groundbreaking ceremony for the receiving center, and then they postponed it. So I am glad I'm not in transit.
Hey, Taylor, will you real quick, I'm just since we're like all settling in, there's not yet a million people. I did just go and update stuff onto like the sign in that you put in the chat, but will you somehow, because I thought I went in and edited the right list to make sure that everything's going to my new email account. But I have a different, I mean, like the Southwest one is still active. So every once in a while, like I'm able to go in and then I just like kind of catch up on the things that I need to catch up on in the prevention world. But I'm still not getting new PCA emails to my new email. So
Okay, yeah, I can go do that. Do you just want to put your new email in the chat or
Sure
just give it to
will.
me? Thank
yeah,
you.
sure will. Yeah, no, I can definitely do that. Anybody else who wants to email me, we can be friends. Okay, it's me now. So thanks, Taylor.
While you're getting settled, remember to go into the chat box and mark yourself here on the roll, and we'll add that link in again after if we have a few latecomers so that they have access to it. Okay, well, we are going to start on time, and I am really excited about today. This is like a highlight, I think, every year to be able to recap what happened at the legislative session and to hear about the outcomes for our substance abuse and mental health bills. And it's kind of I think, a reward in a lot of ways for all of your hard work at the Capitol and throughout the year. with regard to the legislative stuff. So I'm excited. Before we jump into that though, I want to thank Taylor for getting this invitation up to invite everyone to visit the Facebook page. We got your feedback and a lot of people didn't even know we had a Facebook page. So we're excited to be able to share that with you. We want you to visit regularly. And if you answer the question of the month, you'll be in a drawing for a prize. And we also will be putting all of the resources, all of the recordings from these meetings onto one landing page so that everybody has access and they know where to find that. So, okay, so we'll start that recording. And I'm just excited. We'll have Rob go first, but Rob Timmerman, the amazing Rob Timmerman, he's the PFS Region Director in Salt Lake County, and have known Rob for a really long time, and I just totally respect him, and I'm grateful for all the work that he does upstream to help all of us do the work that we're doing. And then after Rob reports on the substance abuse legislative stuff, we're going to have Ray Bailey from the Youth Suicide Prevention Program Manager at the Department of Human Services, and she's going to report on the mental health bills and the outcomes that we had there. So without taking more of their time, I'm going to turn the time over now to Rob. I think you're muted, Rob. Oh, it's the computer, not Rob. So
okay, sorry.
that's okay.
What I was saying is I'm super excited to be able to hang out and talk about what happened during the legislative session, this legislative process. Really fun year, super crazy. For the past 2 years, it had been versions of online only. And this year it was, they allowed people back into the Capitol kind of just about full scale. And so I was up there a couple of times, but I did most of my participation sitting down in my basement, because that's what I do now. Anyway, so it was crazy. There was quite a lot of bills. The last numbered bill in the House, I think, was 496, so almost 500 bills numbered in the House, and well into the 200s on the Senate side. So quite a lot of legislation. This year we tracked several pages worth of bills, and I guess I'll stop and say, when I say we, as part of USAVE, so the Utah Substance Abuse Advisory Council, several pages of bills, just a bill list like a mile long, that we tracked. I'll cover some of the bills pertaining to prevention, and am really glad that that I can do most of those that are pertaining to substances, while someone else gets to do those that are pertaining to mental health, because that was like another huge list as well. And so yeah, I also have, if anybody on here, if you feel like I'm blabbing too much, providing too much information, or blabbing too much and not providing enough information, let me know. Just like start raising hands, or even unmute yourself and just say, Rob, go on. Or Rob, stop, I have a question about this. I know also on here that several of you were actively tracking and or actively participating in the legislative session as well. So if you have additional information that I'm not providing, or additional insights, please feel free to interject those as well, because I think it helps when we all can learn from each other, and all can learn from the process of what happened during the legislative session. So I guess with that, I'll get going. At the outset, I want to thank Christy Cushing and Liz Kelch. I stole from the presentation that they offered to Tobacco Control people on last Friday, and they were good enough to share that with me. And so I've taken that, and I just want to give them credit for producing some of these slides and starting the work so that I didn't have to come up with even a template on my own. So I stole that as well, but they're awesome. Okay, so how I'm going to do this is I'm going to go through specific bills. I'm going to talk about bills on a specific subject that passed and bills that did not pass. And I thought it would be less confusing sticking with subjects of substances rather than sticking with House bills and jumping around to different subjects in House bills and then flipping over to the Senate and switching around in different subjects of the sentence according to bill number. So I'll just say I have not stuck to chronological order or bill number order because I just felt like it would be easier to do it this way. So first thing I'm going to talk about is tobacco bills that passed. And good for us, really there was only one piece of tobacco legislation that passed, and this is HB 34. This was actually legislation that was put together by and at the request of the Health Department, the Tobacco Control people, as well as the Tax Commission. And essentially what this bill does, brought forth in the House by Representative Steve Ellison, is to clarify what heated, not burned tobacco is, and make sure that that is falling in line with what we have on the books for burned tobacco. There was kind of some ambiguity or vagueness on how to treat these types of products. And so this was a bill actually to kind of align everything all together. There are a couple of products on the market that are heat, not burn tobacco products. And again, if there's other tobacco specialists in here that can help fill in some of the gaps, please feel free to offer those. But essentially, what this does is make sure that everything is in line, and we treat tobacco, whether it's heated or burned, the same. We do so in the tax code, we do so in the criminal code as well. And that's what this bill did. And so there actually wasn't a lot of fanfare or pushback on this, maybe some from the industry, but it actually sailed through pretty quickly. It was a pretty fairly easy bill, and the idea of it itself. So anyway, so that bill passed, which is good. Helps out in tobacco control and helps out in law enforcement, and as well as collecting taxes on those products that are sold. Next, we'll go to tobacco bills that failed. And this one is thanks to a lot of work that many of you did and a lot of advocates did. This bill, Senate Bill 130, electronic cigarette restrictions, died pretty early in the legislative process. It was originally a bill proposed by Senator Kennedy from the Senate, and he is the chair of the Health and Human Services Committee on the Senate side, and originally ran the bill as an agreement with some folks from the industry, not really understanding or realizing what it would do. And once he found out what that really was, once a number of you and other advocates talked to him about the bill, he decided he didn't want anything to do with it. And so he actually asked for someone else in the Senate to run the bill. And that bill was picked up by Senator Gene Davis on the Senate side. Senator Davis, likewise, didn't really understand and know what he was getting into. And once he was contacted and educated about the bill and the reasons for state rule, he decided that he wasn't going to pursue it very hard either. And it was from the Senate side, it was assigned to the Health and Human Services Committee. And with Senator Kennedy being the chair, it just kind of never saw the light of day from that. Anyway, the bill It was to essentially undo a whole bunch of work that was done last legislative session last year in the rulemaking process at the state health department, and the work that many of you had done in contacting policymakers, informing them of the potential harm that a lot of nicotine can do and the potential addictive nature, getting kids hooked into nicotine and eventually use of tobacco and all the negative health outcomes that are associated with that, because the nicotine content was super high. And under state law, the health department was given the ability to make rules around content of nicotine. And we got into a huge kind of tug of war over the past year between the legislature and the health department on what and how those rules could be written and what those rules could be. Settled eventually on the 3% nicotine content. This would have allowed products that had received or would receive special pre-market tobacco designation from the FDA to be sold in Utah at nicotine levels higher than what the state was allowing. And it kind of would have created that loophole under this law. The law would have said, yeah, if it went through that FDA process, it would be okay here in Utah, even though it went directly against what we all had established and fought for on nicotine content. Again, there was a lot of work on this bill really early in the session, and it didn't go anywhere. Once people really understood what it was doing, they kind of didn't want any part of it. So this is like a thank you to you all, to all those advocates that really worked on this and try to limit the nicotine content. So good job all. The next one, this one was crazy. This was actually introduced the last couple of days of the legislative session itself. It was read for the first time in the House. Again, see that number, HB 492. This is one of the last bills that was introduced, and not exactly sure why. If this was kind of a, hey, we're going to run this next year, but we're introducing it now so that we could say last year, hey, we tried to run this bill, and maybe it gains a little bit more steam. This is cigar and pipe tobacco purchasing restrictions amendments. Essentially, it creates a system for cigar of the month clubs where people in the state of Utah could participate in cigar of the month clubs, usually by online ordering. And that's where we start seeing a whole bunch of problems of what could potentially be harmful to consumers, especially to underage consumers. And we don't want any part of that. This would have created ways to verify and tax those products. But again, all the problems that come along with that. So this is kind of my interpretation of it, is this is like a heads up bill because this is going to come next year. So start formulating information that you can get to policymakers from your communities of why this would be a bad idea. Currently, we don't allow products to be purchased online and then shipped to Utah shipped in our own homes. There's a whole bunch of reasons for that. Some of it is revenue and taxing stuff, and some of it is just because it's super flipping dangerous. So anyway, this is kind of a heads up thing. This did not go through. Again, it was introduced in the last couple of days of the session, and did not even receive any hearings or other than just being formally introduced. Okay, so that was tobacco bills. I'll move on to cannabis bills. These are the bills that passed. This, the first one I'll talk about, and I'll talk about it in conjunction, as you see down on the bottom, with HB 385. But first, we'll talk about Senate Bill 190, Medical Cannabis Act amendments. The sponsor is Senator Evan Vickers, and Senator Vickers several times had stated that he doesn't want to be the guy that runs cannabis legislation or cannabis cleanup, but it just kind of fell to him, and in some ways he feels like he has a duty because of his professional expertise and his involvement over the past 5 to 6 years. This bill kind of was put together to be the production and distribution cannabis bill for this legislative session, and at the request of the Department of Agriculture and the Department of Health, trying to make some fixes, expand in some ways the program itself. And the original bill itself had a couple of things in there that were not awesome. The substituted bill that actually did pass still had a couple of things in there that wasn't awesome. But one of the important things that it dealt with was really defining what the Medical Cannabis Act program does concerning THC content. Part of the problem that we had started seeing is that smoke shops and head shops, I'll just call them for what they are, were selling products that were not being regulated or were not being treated like medical cannabis, although they contained high levels of THC. And so in this bill, it kind of deals with the medical cannabis program side of that and defines what total THC is, and that anything with total THC more than 0.3% goes into the medical cannabis program, any product in the state of Utah. So total THC means any cannabinoid that has THC or will eventually produce THC once it's metabolized is total THC. And this allows for up to 10% of the total cannabinoids in the product to be of THC. So that means a combination of Delta-9, tetrahydrocannabinol, or Delta-8, or THCO, or anything like that, or tetrahydrocannabinolic acid, which is metabolized into THC directly. Anything of that is total THC, regardless of if it's Delta-9, Delta-8, or Delta-O, or whatever. That should be governed by the cannabis program. It also introduced a couple of different additional ways it can be dosed. And there was a big argument with industry folks on having cannabis drinks in the medical cannabis program, like a 12-ounce soda type drink that was for medical purposes only. And Senator Vickers, he didn't introduce that, but he was lobbied really, really hard, including by other senators in the Senate, to get something like that in. The final bill didn't include that, but it did include additional topical things, including aerosol sprays. So aerosol containing THC, again, under the medical cannabis program. Another thing that this did, and I didn't include them in this bill list, but there was some legislation dealing with what do we do with state employees, particularly employees in the public safety system that have a medical cannabis recommendation. And a couple of the other bills clarified that that is allowed, that a state employee, particularly those in public safety, can be medical cannabis card holders. This bill actually said that, yes, they can be because of that other legislation, but they can't use 12 hours before their shift. And that's obviously for safety reasons. So this bill works in conjunction with House Bill 385, Hemp and CBD amendments. And this was sponsored by Representative Daley Provo in the House. This was the under 3% 0.3%. I shouldn't have said 3%, 0.3% THC because again of all of the products that are on the market that say they're a hemp product or they're a CBD product or they contain some other type of cannabinoid that are being sold all over the place in gas stations and in other places. These products have to contain less than 0.3% total THC. Again, the problem was that some of these types of shops were selling Delta 8 kind of in an unfettered fashion. They just were selling completely, totally high THC content, calling it Delta 8, and it was creating a huge problem. Essentially, people using those products to just get high because they were outside of the medical system. They weren't using them for medical purposes. They were using them for because they were drugs. So this is what then clarifies in state agriculture law that anything less than 0.03% THC is a hemp or a cannabinoid product and can be sold in those types of formulations like creams and other tinctures and stuff, as long as they have less than 0.3% THC. It also did another pretty important thing, saying that cannabinoid products can't be put in products that are a conventional food and then sold and purchased in the state of Utah. They also can't be enticing to kids or be a smokable flower. Last year, a very, very similar piece of legislation passed the legislature, but was vetoed by the governor almost along the smokable flower lines, because that would have allowed for a smokable flower. And I'll walk that back. It would have allowed for a flower to be hemp, a hemp flower. But the scenario given was if law enforcement pulls someone over and they find a flower, they can't in the field right then determine if it's a medical cannabis product or if it's a THC or 0.3% THC cannabinoid product. And so it kind of created this huge thing, and that's ultimately why the governor vetoed it last year. This takes care of that. If it's a CBD product, if it's anything with 0.3% less than THC or less, you just can't have a flower. And on the other side, on the cannabis program side, you actually can have the flower, but you have to have the recommend card as well. Okay, that's that. Was there someone? Question? All right, I'm going to speed it up a little bit. This is Senate Bill 195. So in as much as Senate Bill 190 was more on like the Department of Agriculture and Department of Health sort of stuff, this was more on the medical professional side of the medical cannabis legislation and changes. Probably one of the maybe most not great things about it was that this bill now allows for the treatment of acute pain. It was presented as acute pain usually resulting from surgery, but the way that it was written in the bill was actually just acute pain lasting for less than 2 weeks, and that it creates a limited medical recommendation for up to 30 days. So that's something we now have to deal with. That acute pain is now added to the list of conditions that that people can be recommended to use. A couple other things in there that were pretty major and may be affecting communities. Any hospice type of agency now will be required to have at least one qualified medical provider. A QMP, a qualified medical provider, is someone that is that has gone through the process and is able to recommend cannabis. But another good thing was that, and this was done, there was a lot of work done on this by folks in the treatment space, that a medical cannabis QMP now has to talk about and consider the patient's history of substance use when providing a medical cannabis recommendation. So that's a good thing. The treatment system had started seeing quite a lot of people that had medical cannabis cards that had been being treated for other drug use disorders, substance use disorders, and were coming into a treatment center with a medical cannabis card in violation of those medical center or those treatment centers rules and regulations, and even philosophy, and creating some problems. So at least kind of a baby step. QMPs have to talk about and consider a patient's SUD history before they recommend. Okay, I'll get off of cannabis bills and keep plugging along. I'll do quickly alcohol bills. Senate Bill 176 was this year's alcohol omnibus bill. This is a result of the alcohol policy committee that was put together this past year to look at alcohol policy changes, both from industry side and also from a public health standpoint. And this is kind of what ends up being, totally air quotes here, a compromise bill, because there were things that had been proposed by industry that the prevention advocates on that committee completely fought against, and to their credit, were able to convince those policymakers to leave out of this bill. Some of those were proximity requirements, essentially taking away proximity requirements, and some other things that would have been harmful not only to underage drinkers, but to vulnerable populations, and even those in recovery. And so this is what came with that. Some of the major things that were included in this bill, I think the first and probably most, I don't know, least important thing was that the name of the Department of Alcoholic Beverage Control is now changed to the Department of Alcoholic Beverage Services. That came at the request of the governor, and he feeling that control had a negative connotation, wanted it to be changed to services. So there you go. The DABC is now the DABS, Department of Alcoholic Beverage Services. A major thing that had been kind of happening over the past couple of years, and we all know and are affected by it in communities, is the hard seltzers in grocery stores and convenience stores and things like that. Many of them came in illegally, and no one really knew what to do about it, or didn't do anything about it at the DABC level and at the state. And so we got a whole bunch of products on our shelves in the state of Utah that under Utah law were illegal. So what was done is we kind of changed a little bit of the definition of what can be sold in a grocery store, convenience store outside of the state liquor store system. How that affects what's already on the market is about half of the products that are currently on shelves that are these hard cider type of drinks will have to go back into the DABC, and about half of them will be able to stay in the grocery stores and convenience stores. An explanation of how and why, it will take way too long. It has to do with the brewing and fermentation process and the ingredients that are used to either brew or ferment and distill. And the distillation is an important one on that. Anyway, so how it's going to affect us is we should see about half the products that are normally on our grocery stores shelves back into the DABC. Another thing that I wanted to point out, there was a piece put in there that beer can't contain an additive masking the physiological effect of alcohol. Think of anything other than caffeine if it's naturally occurring in ingredients that can be in beer, but anything else can't. And so this is like, we can't have, along with some of the other laws that I already talked about, we can't have cannabis in beer. We also can't have kratom in beer and other things like that. So no drugs in beer. That's a good thing. Also, another thing that is fairly significant, but something for us to watch, is that retail licensees, if they have a license to sell alcohol and they're like a restaurant, they now can bottle their own stuff, or if they are already bottling their own stuff at their own like brew pub, they now can allow people to take those and consume them off premise. But those patrons have to have come to eat and be in their restaurant to eat, and then they can purchase and take off up to 2 liters of beer from the restaurant itself. As before, that couldn't happen. So that's now can happen. Also, no buying or selling bar licenses. Bar licenses are a super hot commodity. The legislature did not change the formulation of how they delineate or how many licenses there are. And because there's a lot of people that want bar licenses, and a lot of people willing to make money off the bar licenses that they have. Some of them were selling upwards of $200,000 just business to business. And so the state, the alcohol commission didn't want that. It's causing a whole bunch of problems. There's some formulas of like how many bars are in each different part of the state. And that was, one bar from St. George bought a Salt Lake license or vice versa. And so there was just like a whole bunch of crazy stuff happening. So state legislature says no more selling of bar licenses. Also, no gambling, gaming, or drugs, or even drug paraphernalia can be sold in places that sell alcohol. And this is even for off-premise consumption. And so this may be something that coalitions might want to be interested in their own communities, and making sure that people in their own communities are sticking to this. So keep your eyes out. Okay, I'll go on. I'm so sorry. I'm taking a ton of time. I'm going to speed up again. Alcohol education amendments. This is a bill that was proposed last session by Jeffrey Stanquist. In fact, 2 sessions ago. COVID came, didn't have money for it, reran it this year, and is still looking for money for it. Long story short, he substituted this bill and proposed that we take a portion of the money that is set aside for the Utah Underage Drinking Prevention Campaign through Parents Empowered, take some of that money and put it into a campaign for prevention of fetal alcohol syndrome. That ultimately was dropped, and it flipped back to this program that essentially is looking for money, and it will be housed at the Department of Health, and Human Services is now merging, so it'll be Health and Human Services anyway. This is one also that look in your community to see how you can help and promote prevention of fetal alcohol syndrome. And when this program gets up and going, we'll provide more information on it. Something that also went through is the Department of Alcoholic Beverage Services will now create an online purchasing system where consumers in the state can go and order essentially any product that they want. That product will then be shipped to a DABS store convenient to their location, or a package agency, and that consumer will then go to that package agency, provide proof of ID and proof of purchase, and then be allowed to take it from the store. They physically have to go into the store. They can't do it curbside or anything like that. And so this bill, this bill will start. They'll start creating a system with software and all that sort of stuff in July, and I'm not sure when it'll probably be up and running. It'll take several months before it's up and running, but this is now an option for consumers in the state of Utah. Okay, I'm going. I'm going to skip DUI amendments and talk about alcohol bills that failed. Good thing, HB 425 beer order and delivery amendments. Beer delivery failed. A lot of pushback, and this bill, because it was done outside of that alcohol committee, several of people in leadership positions were not very happy with it and didn't even want to like push it through. And so this was also a bill that, even though it was introduced still with enough time in the legislative session, it was never assigned to a committee. as kind of a message that we want alcohol policy really to go through and be vetted through that alcohol policy committee. And so we have once again successfully been able to hold off on beer delivery. Another one that failed kind of again because it didn't go through that alcohol process. The alcohol restrictions, also by the same sponsor, would have allowed breweries, if they're just a brewery and they don't have a license and a restaurant, to be able to sell their product at their brewery or distillery or whatever. This was interesting because alcohol industry actually opposed this as well, because it kind of takes them out of it. This bill also would have allowed for, if you have a retail license, you could have gone to one of these package agencies and purchased from them directly rather than purchasing through the DABS system itself. And so the DABS opposed it. Industry opposed it. Like the beer wholesalers didn't want it because it takes them out of it. So think of your Budweisers and your Coors and stuff, which are part of the beer wholesaler system. It takes them out of it as well. And anyway, so this bill did not pass. That's a good thing. Opioid bills that passed. This is several years ago, there was legislation introduced and passed that restricted opioids prescribed to 7 days. And after that, if a patient needed more, they could go back to their doctor and get an additional prescription, which has really, really helped in prescription opioid reductions in harmful stuff that's been happening. Like this is one of the things that's really, really helped. And that bill was sunsetted. And so this is actually, this was a piece of legislation that extended that repeal date to 2032. So 7 days only of prescriptions, which is
Sophie,
really good.
so just, I'm calling because of like the lintels, like, okay, so the basketball court with
Yeah, that's not
those
us.
two. I don't know, Lisa's gonna call
Charlie,
me
we
back.
can hear you. All right. Opioid bills that were defeated. Representative Jennifer Daly Provo had been working on the idea of overdose harm reduction for quite some time. This is now kind of the third session that she's been interested in this. And her proposal this year was to get a group of folks together to discuss harm reduction strategies here in the city of Utah, things that we aren't doing. We still are having quite a lot of people succumb to the horribleness of opioid addiction. And so it was to look at that. It would have been a group, almost kind of a non-power group that would have reported back to the USAVE Council, and then the USAVE Council would have reported to Health and Human Services. But the legislature decided that they didn't want to do that. And so she's not giving up on the idea of harm reduction strategies. And I'm sure we'll see some other type of legislation around harm reduction in the future. Some of this got started with the concept of safe use sites. And so it's kind of controversial, and it needs to be vetted, I think. So anyway.
Hey, Rob, could
Yeah.
you back up to one slide before? Michael's asking if this includes convenience stores. Maybe it's the alcohol
So-
one. I missed that.
Back in alcohol.
Yeah.
Yeah. Maybe you just take yourself off mute and ask. I can't see the chat right now. I mean, I
Yeah.
guess I could if
Michael,
I'd done
can you
for it.
respond to that, to your question, please?
I think it was a couple of slides ago, and yeah, it was where they couldn't do it if they also sold alcohol or drug.
Yeah. So that does include convenience stores. Right. So so my eyes were open one time. I went to a convenience store in South Salt Lake when I was working with the South Salt Lake Coalition. And, they had these beautiful little flowers that are in this little glass vase, and they're just really pretty. And they're only like $1 or something like that. And it's just like pretty little flower thing. Well, you take the flower out and that's a crack pipe. That's the whole purpose of it. And so things like that, that's drug paraphernalia. And there may be some loopholes and things like that that legislators are trying to close and will continue to try to close because people are going to continue to take advantage of them as well. I'm sure the store owner was sold like, hey, these are beautiful little flowers in this beautiful little vase. So stuff like that in convenience stores is, they're illegal. So
Bryce is asking who the enforcing
So
authority is for that.
yeah, so it's now in criminal code. So police. Is it being done or not? Like, no. I mean, drug paraphernalia in and of itself is illegal, but again, there's so many loopholes because it's not a crack pipe, it's a vase. So anyway, let's have more conversation about that at a later date. So I know you're all are dying for me to finish. Okay, I'm gonna finish. I promise. The last bill, sorry, let's close your eyes for a sec. Okay, the last bill that I want to talk about is HB 167, Mental Illness Psychotherapy Drug Task Force. This is putting together a task force to study and recommend policy on psychotropic drugs used for treatment of mental health related illnesses. This passed, a task force will be created. We tried to get a prevention professional on this task force as a named person because we think that's a really, really good idea. And the sponsor of the bill and those that had worked in creating what the task force was did not want that. They said there was a whole bunch of reasons of specific reasons of who was invited to be on that and advised us to work with the Director of Health and Human Services to get prevention into that work group. So that's what we're going to do. Anyway, this is, I've called it, it's been referred to in the news as the mushrooms bill. This is really the idea of there are some Schedule I drugs that are showing some promise through research of treating mental illnesses, and the state of Utah doesn't want to wait for the federal government to do anything with those products. They want to just do it themselves, like we did with cannabis. So let's keep an eye on this one as well and try to get some prevention information to those on the task force. I'm going to stop because I've taken a ton of time. Last thing I'll say is policymaking is a process. I've talked about it before in spandex. It's a process that we can't just do during the legislative session or the week before the legislative session. It needs to happen throughout the year. And with that, I will stop sharing my screen. If you have questions though, contact Chrissy or Elizabeth, Liz Couch. They've got a ton of information. Really follow this stuff really closely, and or you can contact me, and there's my contact.
Awesome. Thank you so much,
Thanks,
Rob.
guys.
I
Sorry it took
just
so
want to
long.
know if I'm the only one that giggled just a little bit when he said that the DABC is now DABS. Anyway, I don't know.
They didn't consult us.
Maybe I'm the only weird one that found that funny, but anyway, thank you, Rob. That was excellent. And I appreciate that you gave people the opportunity to reach back if they have other questions. But just a really good recap. And we appreciate your knowledge and your willingness to share that with us. And now we will have Ray Bailey. And I'm excited to hear from Ray so that she can update us on the mental health stuff. And thank you so much for being here. We'll turn the time to you.
Sure, thanks for having me. Filling in for Allison, who is unavailable today. And I feel like my presentation is way less robust than Rob's is, so I feel a little shamed. But hopefully it's concise enough that you get the information you need, and hopefully I can answer any other questions too. So let me, okay. All right, so in terms of suicide prevention and mental health legislation this year, in terms of things that have sort of like a community or like prevention implication, there wasn't a ton. So in terms of suicide prevention, a couple things. Steve Eilson had put forth a Live On, which is a statewide suicide prevention campaign, a license plate for that designation, and would require a donation to the governor's suicide prevention fund. Also, I did not introduce myself, so let me do that quickly. I'm Ray Bailey. My pronouns are they, them. I work with Allison Faust at the Division of Substance Abuse and Mental Health, overseeing our youth suicide prevention programs, as well as co-chairing the Utah Suicide Prevention Coalition's LGBTQ+ work group. So that's sort of where I'm coming from with these, just as an aside. So, all right. So other than the Live On license plates, which is very exciting, we don't know when that's going to happen or exactly when we'll be able to get them, but I'm definitely excited to have one. Even though I think that the Utah license plates are beautiful coming from Delaware, which has like the most boring license plates. Anyhow, so House Bill 236, which was also from Representative Eilson, which is behavioral health amendment. So this is sort of like the main suicide prevention one this session. And so it adds a public education campaign about warning signs of suicide, suicide prevention resources to the sort of list of allowable state suicide prevention activities. And it adds $2.4 million for public education, a public education campaign, which will be Live On. And then allocates $350,000 for comprehensive suicide prevention grants, which will be administered by DSAMH, which we are this year doing comprehensive suicide prevention grants. So we're excited to be able to extend it to other areas. And those grants sort of help local areas, local mental health authorities and health departments put together a comprehensive prevention, intervention, postvention plan for their area. And making sure that as an agency, they are implementing those things, making sure that they have a postvention plan just in case, but then also for their community. So it's exciting that we get to keep doing that. So in terms of from the Senate, I don't know if this is necessarily prevention. I don't know. I kind of see like a lot of things as prevention that are pretty far upstream, but Senator Escamilla put forth the community health worker certification process, which would create a voluntary state certification for community health workers. So it's not mandatory. You can still do like public health work without it, but it is just sort of a certification that has like a training component and a certain number of hours served. So I think that's a cool opportunity. And then Senate Bill 171, which is a behavioral health curriculum program by Thatcher. And that would require Huntsman Mental Health Institute to develop a youth behavioral health curriculum, which is an interesting bill because we already have mental health standards in schools in Utah. And curriculum for that. So it's already being taught, but there was pushback against this bill. So I think that people maybe just didn't know that students are already learning about mental health in schools. And there was some pushback in terms of whether this is appropriate to be talking about mental health in, in schools or for kids to be talking about this, which obviously I think it's great that they, that there is so much of an interest that they would put forth this bill and pass this bill, and interested to see what Huntsman Mental Health Institute comes up with. So I guess more to be seen there. And then sort of more general mental health. So their House Bill 23, which is the first responder mental health service amendments, it requires all first responder agencies to provide mental health resources for employees, spouses, children, and retirees. And it appropriates $5 million for 2023 to be for the Department of Public Safety to administer a grant program so that mental health resources can be administered to first responders. So I'm not sure who those grants are going out to or how that's going to be administered, but I would imagine sort of like local mental health authorities, local prevention coalitions may have hopefully somewhat of a role in this. And then House Bill 283, which is mental health professional licensing. So it amends the existing Mental Health Professional Practice Act, and it reduces the number of clinical hours required for licensure as a social worker, marriage and family therapist, or clinical mental health counselor. So this was something that my colleagues and also the folks at USAVE were not in favor of, but it did pass. So just to know, I mean, so it's less of a barrier, I guess, to getting people into these positions that we definitely need, but sort of taking away that experience component is a little bit worrying. So, all right, so sorry that I'm like running through these, hopefully I'm being clear. But so the last two bills are bills that did not pass. And just as a state and also in my role with the LGBTQ plus suicide prevention work group, I just wanted to bring it to your attention. So House Bill 11, which is called Student Eligibility and Interscholastic Activities, Representative Birkeland had brought this forward. It was also brought last year, but it didn't pass. So it was really, in some ways, really great. So this bill was about, in some ways, limiting participation for transgender girls from participating in interscholastic sports at the like K-12 levels. And Representative Birkeland took back the feedback that she had from this bill from a lot of people who work with, especially transgender youth. And she worked with Equality Utah. And I don't think that the bill was perfect, but she really did take that into account. But on the last day of the session in the Senate, a last minute substitute that like completely changed the bill was brought, and it would completely ban transgender girls from participating in these sports. And if there is some sort of legal action about this, it creates a commission to establish sort of like a baseline range of student characteristics. So like, what is the baseline for a girl or a boy, and would assess students based on that if they're allowed to participate in these sports, which is horrifying for a lot of reasons, especially in terms of, student safety and this sort of like assessment of their bodies. But we know that participating in school activities and participating in sports, exercise, are so good for mental health, and to just ban a group of people who are at the highest risk for suicide or, like feelings of rejection, that sort of thing. It was very upsetting to see this passed. But it did pass last minute, so there was no opportunity to have any new hearings about the way that the bill had changed. So that was pretty disappointing. And Governor Cox is already committed to vetoing the bill, as he did last year. He didn't need to veto it last year, but he said that he would. But there is some growing pushback from some groups in the state in terms of trying to overturn his veto, so to keep this in place. I hope that doesn't happen. I think it would be really horrible for these poor young people. There are only 4 transgender students who are currently playing sports in Utah in public school sports. So it's really a a bill that's not necessarily responding to like this big issue that they're making it out to be. So, and I think it's going to cause way more harm. And then the medical practice amendments, which were brought by Representative Shipp, House Bill 127. It is a repeat of the bill from last legislative session. It didn't move forward out of, I'm not even sure that it moved out of the Rules Committee this year, but it would consider gender affirming care for youth, which includes what they call medically unnecessary hormone treatments or puberty blockers or surgery, as professional misconduct for doctors. So essentially banning doctors from providing this life-saving care for young people, for young transgender people who again are at very high risk for suicide. Yeah, so just I think also a note that we know that when bills like this that are targeting especially LGBTQ young people are talked about, like in the discussion around the girl, making sure that transgender girls couldn't play sports. One senator did compare, use a comparison to like racehorses and in terms of like their physical ability. So like sort of like an almost like eugenics, creating an idea that like trans people are animals or like livestock or something, which is like very harmful. And kids are hearing this and older trans people are hearing this. And so usually calls to crisis lines for these youth go up around this time. And so just, a note to be mindful of the trans youth in your communities. And if, maybe some more education needs to be done about why this kind of healthcare is necessary, even though it didn't pass this year, I foresee it coming back again. And why it's important for young people to all be able to participate in school activities, regardless of what their gender identity is or, what a commission decides about if their body is, female enough or male enough or anything like that. So that is what I have for you. Sorry, I sort of ran through that, but if you have any questions, I'm happy to try and answer them. But yeah.
Bailey, Ray, thank you so much for filling us in. I am going to open it up for a few minutes, and if anybody has any questions, I feel like maybe, we've talked about this so much, but advocacy is education. And I think especially with some of the bills involving our trans population, hopefully it's a lack of education less than prejudice. So take the opportunity to educate your policymakers. Those last two bills that you mentioned almost seem to be in conflict with one another, measuring how male or female a student is, and then also, talking about gender affirming care being not appropriate. And so, education's key on all of these things, and revisit some of the bills that both Rob and Ray spoke about as far as the ones that may come back next year, and start doing that education and that advocacy right now, not waiting till next year's session, reaching out and creating those relationships like we learned how to do that last year. So again, just keep your eye on these issues that may come back again. And I'm just going to open it up for a minute and see if anybody has any questions. And again, thank you so much, Ray and Rob. You guys are amazing, and I appreciate everything that you do to help us stay up on top. So. You must have covered things very thoroughly because no one's stepping in. Okay. If you didn't sign the roll, Robin, I got you. If you didn't sign the roll, please hop in and do that. If you need us to post it again, we can do that. But And if you guys know other people that would like to attend these webinars and are not getting the email, please reach out so that we can add them to the email list. There's the role. Thank you, Taylor. And I guess we'll hop off if there are no more questions, but again, thank you. I will stop recording.